Hi everyone, as promised, we are having the Zoom conversation. Dr. Mrinal Prakash took out time from his really busy schedule and decided to be a part of this chat. Thanks to all of you who sent in the questions beforehand. It gave us direction, and what kind of questions and responses you're looking at. And without wasting any more time, I would like to jump straight into it. Mrinal, there was an issue actually. I do not know how to start the conversation. Should I call you Dr. Mrinal or should I call you the legend Mrinal? Because
I think
the
just
kind
Mrinal will be okay.
the kind of work that's very nice and humble of you, but the kind of work that you and along with the entire frontline healthcare workers have put in the last year, we cannot sit at our homes and fathom the kind of things you go through on a daily basis, and it is a war-like situation. So on
Yeah.
behalf of all of us, the healthy ones, the COVID patients, the ones who are recovering, from all of us, really, thank you so much. I think what you're
Yeah.
doing is incredible. Um,
Yeah, you're most welcome, Irony. But I think it's our job, right? Like we're
yeah,
supposed to do, and helping people is why I became a doctor, right?
yeah,
So I love what I'm doing right now. So yeah, and I really
amazing.
appreciate what you are doing actually.
Yeah, yeah, and the reason I did this was Mrinal because there is so much information out there to consume on
Yeah.
WhatsApp, on social media, online. Suddenly, everybody is a doctor now. Even our lifestyle influencers become a doctor. Everybody is giving opinions and everybody is giving some kind of a home remedy. But in fact, after reading all that as well, when I was diagnosed with COVID-19, when I tested positive, I was absolutely lost. I had no
Yeah.
clue where to start, what to do, which shows that people like me who read so much information are absolutely clueless when it comes to them and their families, right? So,
I'll tell you the what is the problem. So with
yeah,
COVID, it's a new disease. It's a novel disease. So
right,
every day the treatment is changing, right?
right,
So the like in your case, if you remember, I gave you ivermectin, and I told you
yes,
it's a really nice drug. I have given it to so many patients. And
right,
even 2 weeks back, Goa government told that every 18-year-old or more should take ivermectin as a precautionary measure. And now
right,
WHO is saying that ivermectin is not to be given. It's not part of the treatment now. So
right,
every day the treatment is changing. So probably the people who were treated in December, the treatment that they got, and now what we are treating, the treatment can be absolutely different. So yeah, that is the issue. So for the treatment, you have to contact the right people. And there's so
right,
much misinformation, like you told me. So that is creating more confusion and creating problems for us also.
right. So, when I reached out to you for help, and when I was the first day of my symptoms, I remember you said that immediately
Yeah,
start your treatment. This is what you have to do
yeah,
next, right? So, don't wait for
yeah.
your results to come and don't wait for things to, kind of go forward in a bad way. Just start on the treatment. So, I have some questions regarding, specific questions that our audience has sent in, and maybe you could answer some of those for us. The home recovery, people who undergo home recovery, like you said, so the medication needs to be started from day one of the symptoms.
So I'll tell you, whenever a patient comes, there is a treatment for that, right? But we have to see at the practical aspect also. Where is the patient? Is the patient in a village? Is the patient in the city? So what is the condition of the patient? What is the age of the patient? So normally in Delhi, I think 1 month back it was taking 3 to 4 days for the RT-PCR tests only. And for a 70-year-old person who has very high grade fever, his SpO2 is dropping. For that, we cannot wait for the tests. In that case, I'll tell him, to start the treatment because the drugs are relatively safe. Okay, so that is the reason. So a lot of factors you have to see. Now, if a patient is a 30-year-old with mild fever, oxygen is normal, I'll tell him to, take Dolo 650 or any painkiller or any antipyretic for fever and wait for the results because in that case, we can wait. So the treatment and what I suggest changes, based on the patient and where he is, based on socioeconomic factors. So a lot of things are there. Ultimately, we want the patient to get better, right?
Yeah,
So in your case, like I told you to start the treatment because RT-PCR was taking 3 to 4 days and you were having high grade fever. So
right,
in your case, I told you to start. So
right.
yeah, that is how you have to change. You cannot follow the book in every case. That is the issue during
Right.
a pandemic.
We have another question that says that somebody has been negative since the last 20 days. However, she still has sore throat and headaches on and off. In fact, that's my question as well. I'll come to that. So, why do you think that is, or maybe what can be done, or is it a normal thing that people still have sore throat and headaches 20 days later as well?
Yeah, I've been getting this question a lot. So in COVID, the major symptoms are fever and breathlessness. They are two most common and major symptoms. But other symptoms like sore throat, headache, some loss of taste and smell, these can persist for 2 weeks, 3 weeks. Also, even after you have tested negative, even after that, you can have one spike of low grade fever, say 99, 90, 100 something. You can have sore throat. But the thing is, you don't have to worry about it. You just have to continue the medication that was given to you. Like we after 10 days, we give patients vitamins and calcium and all those supplements. So you have to continue with that. But along with that, there are other things that you should do. First is diet. So diet should include high protein diet, less oil, less fatty food. Home cooked food should be preferred over outside restaurant foods.
Yeah.
Then sleep is very important. The body needs rest. During rest only the body rejuvenates, right? So rest is very important. Then exercise, basic exercise like just walking for 5 minutes. You can start with that. Even CDC recommends the same, that even mild to moderate cases, once you have tested negative, you can go for a walk for 10 minutes, 5 minutes. If you have a terrace, then best. Then in open air, you can helps you with the mental
Right.
well-being also. So all these things you should follow. So
Right.
basically, the point is not to worry. Just continue this treatment and just wait it out. You'll be fine. Unless you have very high-grade fever, you have some shortness of breath, you have say tightness in the chest, then only you have to consult a doctor. Otherwise, if mild symptoms are there, sore throat and all, just wait it out. Do gargle, do steam inhalation. You should get better
Okay.
in some time.
So,
Yeah.
the recovery is not a short term recovery, like you're saying, it's a long term process. So, we have to be a little patient, even if the symptoms
Yeah.
don't go in 20, 25, 30 days, right?
Yes.
Okay.
Yes. Yes.
Okay.
Even I would like to add that not just COVID, even after normal viral, what we have normal as in what we used to have earlier, viral infection for 3 4 4 days.
Hmm.
Even then, some people have body ache even after that. We call it, since I'm an orthopedic surgeon, so we call it post-viral arthralgia. That even after a major viral or any viral infection, you can have body ache for some time.
Yeah, the panic is real. I remember,
Yeah.
messaging you like 20 times a day that week when my symptoms were really bad. And you were like, I'm
Yeah.
there, don't worry. But, the panic just sets in without you realizing. We have another question which says that, it's been a month since she has had COVID. Obviously, she is now negative, but she has, like you said, a weakness, body pain. However, she's got itching in her eyes and also has a lot of neck pain. So you think that is also something that goes with time?
That could be a post-COVID sequelae only. About the itching in the eyes, if there is any redness, if there is severe pain, then she should consult an ophthalmologist for the specialist opinion. But if there's regular itching, then basic anti-allergic eye drops and lubricants that should work for her.
Okay.
Unless there is some redness, some discharge from the eyes, throbbing pain, something like that, then she should consult an ophthalmologist. But yeah, these things can happen.
Okay, this is also a part of the recovery, which
Yeah,
brings us to
yeah,
the fact that it's the recovery is so different for different people. Like I have not had this,
yeah.
somebody else had it. This is a very pressing question, Mrinal, because everybody in the country seems to have a different opinion. How much gap between the vaccination and you testing negative? How much gap is ideal?
I'll tell you, I get this question at least 10 times every day.
I'm sure.
And there are studies which say you should take it after 6 weeks. There are studies which say you should wait for 6 months.
Okay.
Okay. So because the antibody post COVID, there is antibody formation, which protects naturally, which protects you against COVID. So that is there from 3 to 6 months. Okay. So that based on that study, people are saying to wait. But there is a group of people which are saying to take after 6 weeks. What the government of India is saying, what ICMR is saying, to take after 1 month. So that
Okay.
is what I tell people to take after 1 month. This is what the
Okay.
government of India is saying like today.
Okay. So, as per you, 30 days is a good time between testing negative
Yeah.
and taking the vaccination shot. Okay,
Yes.
fair enough.
Yes.
This is a very funny question, and I'm glad people are finding humor in this. Does clapping really hard and loudly increase the O2 levels?
I have so many answers for this, but I don't want to be
Yeah,
politically incorrect.
of course.
Yeah, clapping can help if you are in a prone position.
Hmm.
Lie down on your belly, and then if you clap, then your oxygen level will increase.
That is, well, that's smartly answered. Um,
Yeah.
it must be difficult to be a doctor in this country, no? Sometimes you like want to say something, but you really can't. You hold back. Because,
Uh,
well, this is a question that's been coming because I think sudden scare of this black fungus is doing the rounds. So if you would,
yeah.
give us a little bit information about what is black fungus and why is it so dangerous?
So yeah, the problem is real because today I was in ER duty, emergency duty. So today only 4 patients with uh, mucormycosis or black fungus suspects came. So it's actually a fungal infection. It's naturally present in dust and soil and at construction sites and all. It's not a new disease; it's a old disease only. But the thing is, during COVID, because of rampant use of antibiotics, steroids, and immunocompromised patients, what is happening? The immunity is going down, and even obviously because of the COVID also, the immunity is going down. And since we are
Yeah.
giving antibiotics, so the fungal infections are increasing because antibiotics, doxy, and all those things are acting as the bacteria. So the fungal infection is increasing. So and it has so it starts from the nose like and eyes like there can be discharge from the nose, blackish discharge. There can be redness in the eyes, throbbing pain in the eyes in the sinus area. So that is how it starts, and it can progress really fast. Okay, so people have to know about what is this disease, not to get scared of it, but what is it? What are the early signs? The early signs, like I told you, are this only: eye pain, nose discharge, blackening in the near the nose, near the eye, all those things. And look for these signs if they are having it. People who have uncontrolled diabetes, who are immunocompromised, so they should be checking actively. Check for these signs. Okay,
Right.
and if they have it, they should consult an opthal or a ENT or whosoever is a specialist. Consult a doctor, but it has to be actively managed. You cannot wait. If you are having those things, then you wait for a day that it will go. Doesn't happen like that. But you cannot take chances with this because it progresses very fast. It can go to your brain, to your lungs. So all these
Yeah.
complications are there.
Okay. Sounds. I mean, obviously, you are trying us not to be, not to be worried and scared, but it sounds like something that needs immediate attention. There is this, this scenario, and including yourself, you're a surgeon,
Um,
orthopedic surgeon. You are actively a part of the COVID ward for more than a year now. How are different kinds of doctors who specialize in different fields coming together and supporting the COVID-19? I would say the war of COVID-19 versus the humans. How are you all coming together from different specialities?
it's the need of the hour actually. So normally, what I get two questions: whether an orthopedic surgeon like me, a skin specialist, or a general surgeon, whether OBGY, whether they should work in COVID or not, because we are not. So we all do basic MBBS, but we are not trained pulmonologists. We are not trained general medicine people. And the second thing is whether the patients should go to them or not, to people like us who are not. So I'll answer both the questions. So as we know that in India, there is a very high patient to doctor ratio. Like, you know, so and during pandemic, where there's so many 3 lakh, 4 lakh cases every day, we have to use everything. Whatever we have to use. So I was
Right.
like you told, I was in Bombay for a year. There, even final year MBBS students, third year MBBS students, even they were helping us. So they were in the call center. They were listening to the symptoms because a doctor can, take a rational decision. He
Yeah.
knows when to refer the patient, when to treat the patient. So we were trained in COVID. We like even now I read at least 2 to 3 articles every day because like I told you, treatment is changing. So people like us who are not trained pulmonologists, but since we have seen so many patients, since we are reading it every day, since the government is training us, at how to manage the ICU, how to manage the ventilator, and all those things. So we are also trained now. So we have to help our, pulmonologists and general medicine brothers. We have enough knowledge to treat mild and moderate cases. Severe
Right.
cases, we obviously refer to the hospital and then they can take care of it. But we cannot put the burden on them, then how will they won't get anyway, we have shortage here in India.
Right.
This is the first thing. The second thing is, yes, the patients should go to general physicians, to other doctors who are trained in COVID.
Right.
They can obviously go, because now that we have, the government is also training us, and since it's a pandemic, we have to contribute.
All hands on
So
deck,
yeah,
like they say.
yeah, yeah, all on
Yeah,
Sunday.
yeah, it's like a task force, COVID task force. This
Yeah,
interesting article, Mrinal, on this new drug that's being developed as we speak, or I think it's already developed by
yeah,
DRDO, which is like a pseudo
yeah,
glucose. Okay,
2D,
would you
yeah.
like to throw some light on that?
Yeah, it's actually a repurposed drug. It's 2-deoxyglucose. We have been using it for treating cancer, but now the DRDO they did a study in I think Delhi, where the results are very good. So it actually reduces the viral load. It reduces the spread of the infection in the lungs, and it reduces the oxygen requirement for the patient, and hence it reduces the it increase of recovery rate, so less hospital stay and everything. So people are calling it a wonder drug, but yeah, we have to wait and see for the results. They have started giving it in mild and moderate cases, because it is reducing the hospital stay. Yeah,
I had a question from two people, in fact. So they are friends, and they both
yeah,
had COVID-19. They both recovered and tested negative. Now one of them lives with her parents, senior citizens, both vaccinated. But she wants to know that if she steps out, meets other friends who already had COVID, and she comes back home to her parents, could she be a carrier, or could she be a transmitter uh, of the disease, of the
no.
virus?
So according to CDC guidelines, they say in mild cases, after 10 days of first day of symptoms, you become non-infective. And in moderate to severe cases, 20 days after first day of symptoms, you become non-infective. So in India, what we are following is that after a patient comes out to be negative, test negative, we still tell the patient to stay in 7 to 10 days of isolation. We have a more conservative approach, which I feel personally feel is okay.
Can carry the disease back to her parents, or she cannot be a carrier? Say she goes out,
That's what. Yeah,
and she's in the market or something, and then she comes back home. Uh, there's no
yeah.
chance of her carrying it from somebody who is an active carrier of the virus.
So I'll tell you, she can get infected, but the since the body has immunity, it will fight it out.
Okay.
So that's what we are saying. Even if you are double vaccinated, even if you have just recovered, you have to wear masks. We
Yeah.
have to go out. Even if you tested negative today, no doctor will tell you, okay, you can roam around with no masks.
Yeah.
Because
Right.
it's a novel disease. The protocols, everything is changing every day.
Right.
If everybody is fighting for remdesivir. It's the new
Yeah.
drug. People are selling it for 1 lakh, 2 lakh rupees. And recently in April, WHO said that there is no substantial proof that remdesivir treats COVID.
Yeah.
And India is actually importing remdesivir from outside, and the countries are donating it. So it's a very novel disease. We don't actually know how, what is the reality and what is happening. So it's better to be conservative, better
Right.
to wear masks when, even after you have tested negative, we should take all the precautions.
Right. Right. you know I understand that you're not a therapist, or somebody who works in psychology, but how much
Yeah.
a lot has been said, and a lot has been spoken about mental health and COVID, right? So when I was active, when I was positive, and I had the symptoms, it just felt terrible to be in that space, like, oh, I have not stepped out of the house, but I got it, right? But now, like I
Yeah.
am, I'm negative, yet I have these really bad headaches and I have these, chest pains and all. And you're like, is there an end to the disease, or it's this is my life now? Is it going to be like this forever? So, do you have something to say for people who are maybe either fighting COVID themselves or have somebody at home they're taking care of who's COVID positive? How can one just, keep their minds free of stress and negative thoughts? I know it's very difficult, but
You have asked me a lot of questions in the same line.
sorry.
I'll
Yeah,
I'll I'll go one by one.
yeah,
So first thing is, I absolutely agree with you what you're saying. There is too much negativity right now. You know, whenever you open the news, whenever you read something, whenever you talk to people, there's this negativity around that. There is no vaccine. People are dying. Only negative things are there. 30-year-old person, 30-year-old patient died. All those things. It is infecting younger generation also, and all those things. But we are not, we have to look at the other side also. If 3 lakh people are getting infected, lakhs of people are recovering also on the same day. Most of the people, 95% people, we can treat them at home. Okay. Only few percent people end up in the hospital. And from those 4% also, only a few percent go to the ICU. Okay. So we have to look at the brighter side. I know that disease is bad, people are dying, it's very sad, but we have to, keep our morale high. Actually, I received just before this discussion, I was on a call with a patient who's in defense. Okay. And army man, he's 29-year-old. And so I was speaking to him, and he was telling me that whenever he goes off to sleep, there is chest pain. He got himself tested thrice in the last 1 month. Okay. So even if, strong people, like people who are in army, who are, used to taking so much stress more than both of us, even
yeah,
they are under stress because of this. So it is very natural to be stressed out because of the disease, because of the what we are seeing around us. But we have to look at the brighter side. People are getting vaccinated. New vaccines are coming in. New drugs are coming in. So, so yeah, that should be the approach. The second thing is, if you like, remember, if you when you called me, I was absolutely relaxed. I just first tried to, to tell you that it's okay. Everybody is getting infected. Almost like every friend of mine,
yeah,
got infected this year or last year. But so you don't have to worry about it. You have to do simple things. Like simple thing is first is monitoring. If you tell somebody go get a CT scan, then he'll go and get a CT scan done. But if I tell my patients to check your oxygen level 4 times a day, he will not do that. So
yeah,
that behavior has to change. It's a very simple thing. You just have to put the pulse oximeter and check, because you have to stay one step ahead of the disease. You know, if you are feeling breathless on day 5, that means your SpO2 started dropping on day 1, and you gave it 5 days to get bad. So you have to check it's a very basic thing. Then you check your temperature 4 times a day, check your respiratory rate if you can, check your blood sugar level if you're a diabetic. Why wait for the major symptoms like chest pain and all those things to happen? Just
yeah,
do these basic things. And second thing is, don't read don't read WhatsApp too much,
yeah,
because even everybody is schooling everyone. Random messages come, somebody says take this wonder drug and you will be fine, do gargle in the morning with this syrup. I cannot take names, but yeah, you
yeah,
understand what I'm trying to say.
yeah,
Even sorry, even some health officials are also uh, propagating the wrong information. So what I do is I speak to the people who are actually part of the task force. I read what the government of India, not the ministers, what ICMR, what AIMS is saying about the disease, and what CDC US is saying. I don't listen to ministers or any doctor I come across. I just read papers, journals, all those things.
yeah,
And I would request the patients also to not to worry. Even if you have mild, moderate, severe symptoms, you must consult a doctor. Even if your oxygen is 98, even if you are 25-year-old, you have to include a doctor in your treatment. You cannot ask a relative that Mama ji ne bola tha ye khane ko. You
yeah,
cannot do that, because a doctor knows when can it go bad, when to change the medicines, when to get the CT scan done. So you have to rope in the doctors.
That's very nice to hear from a doctor, because you're on ground, you know the reality, and that if
Yeah,
you
thank
tell us
you.
things are going to get better and medicines are coming and new drugs are being researched on, that gives us hope.
Um,
And you're very right about not listening to the ministers, because our ministers say things like coronavirus also has a right to live. So
exactly.
I mean,
Next time they will say get Aadhaar card for them.
yeah, like that is so intelligent. I mean, I good you don't listen to them.
Um,
Um, Thank you for saying that. I think it's important that people hear it from someone who's seeing this day in and day out, and not say a
yeah.
journalist or somebody at home, because you know the ground reality that things are going to get okay. If I'm hearing that SOS requests have come down now, beds are easily available compared to what it was 3 weeks ago.
Yeah.
Um, yeah. Uh, any
One more thing I would like.
yeah,
One more thing I would like to add on the positive thinking note. If you remember, US was the worst hit country at one point of time.
right.
Okay. And few days back, Joe Biden said people who are double vaccinated can remove the mask.
Yeah.
It's a landmark thing that has happened. The country which was way ahead of us, at one point of time. Now, officially, the government has told them that you don't have to wear a mask if you're double vaccinated.
Yeah.
So good things are also happening. In Mumbai, we were seeing so many cases. Now it has dropped down to, 15, 1,200 cases a day. At one point, it was 20, 10,000. So good things are also happening. So yeah, that's what positive frame of mind is very important.
Important. Yeah, it's hard, but it's important. Um,
Yeah.
it's nice that you brought this up. About mental health a little bit, about not panicking, because that's what we tend to do as non-doctors, as mere mortals. The first thing is you start panicking. So I think these things that you shared would be important. And one last question I have. This is just a personal question. About you as a person. Anything in the last year, any experience from the COVID ward that has given you hope, or that has made you feel proud that yes, I'm a doctor and I'm doing this and I love what I'm doing. I'm being able to help people. Any particular incident from the COVID ward that you like to share with us?
Uh, I'll tell you, a patient taught me a lesson actually one day. So I
Okay.
would like to share that story. So I think it was the beginning of the pandemic. I think in March or April of last year, when the migrant workers started going home, when people were walking from Delhi to Patna, from Pune
Yeah.
to Aurangabad, all those things. So that was my first day of duty. I was wearing those PPE kits. Okay,
Okay.
it was very hot. I was wearing two N95 masks, above that a face shield, then the hazmat suit and everything. And I was in a government hospital, and the fan was not working, and there was no AC, obviously. And I was on night duty, like 9 to 9. So I was actually complaining that it
Right.
was very hot at that point of time. So around 12 o'clock, three people came, and I asked them that, about their history. So he told me that he has come from Pune, which is around 170 kilometers from Bombay. He has come from Pune, and people in his colony, they are not allowing them. So they need a
Okay.
certificate which says they don't have COVID symptoms.
Okay.
Okay, so I just wrote they didn't have any symptoms. So I just wrote the letter, and I just asked them that why did you walk from Pune to Bombay? I told him that people are dying. People one day before, only people who are walking from Delhi to Bihar, I think few people died because of the heat stroke and everything. So I actually asked them why did you walk for so many kilometers? So he smiled at me, and he said the guy who started walking at
Yeah.
4 in the morning, who reached Bombay at 10 o'clock,
Hmm.
he smiled at me and he said, "Sir, they walked for 500 kilometers. That is why they died. One kills 160 kilometers. You can walk no in one day."
Oh
So
my
that
God.
was and exactly that guy walked for 14 hours and he was smiling, and I was there in my PP kit for like 3 hours and I was complaining. So that gave me a lot of introspection, and all those things happened, and I realized no, people are suffering and I really
Yeah.
need to help them.
Yeah.
And so yeah, from that day, he actually told me that in 3 days nobody gave them food. On the way, people were giving food. NGO, policemen, all those. actually were giving bananas and curd and everything, but
Yeah.
they had not eaten anything in the last 3 days. So when I compared my situation with theirs, then I realized, I have to help people. And after that, I've never complained about anything. Even if you call me at 2 o'clock at night, I won't complain.
No, that's, these experiences are so surreal in a way that they make you feel very little. They make you feel that your
Yeah,
problems are nothing. And, and
exactly.
like, for example, I got better with home isolation. I have still a lot of symptoms that'll take time to go. Like I keep telling you, But I feel that I'm so fortunate to be able to sit at home and isolate and get better. And there are people out there who are struggling in hospitals and the pain and the misery that's around us. So I think this one thing that I've learned from this experience or just COVID in general is just to be grateful and just to be humble and put your head down and
Yeah,
just live your lives, because
yeah.
the pain and suffering of other people is just humongous. It's huge. So
Just
yeah,
be compassionate with everyone, even like the
yeah,
patients, the relatives. They are going through a lot.
yeah,
So even if something used to happen in the hospital, the patient used to get angry or the relatives, I used to, try to calm them only because you don't know what they are going through. Patient is bad. They are just raw emotions.
yeah,
So you have to be compassionate about that. You cannot just, you have to
yeah.
understand them, what they are going through.
No, that's really nice of you to say because I see these reports of patients' relatives getting aggressive with the doctors, and you feel bad, you feel angry that hey, come on, the doctors are doing so much for you with so little that they have in terms of resources. But then, like you said, that what they're going through, because when they know maybe they're going to lose the loved one, that frustration and that anger, though it's not the right thing to do in terms of just being rational, but it just human emotions. You really have no control over it.
Yeah.
Thank you,
Uh,
Pranal, for answering the questions with science and facts. And people can take a break from the WhatsApp universities now.
yeah. That's the
And
only thing I want to add. Just go to the right people. Don't worry. Monitor the patient, and yeah, everything should get better soon.
yeah, here's hoping. And I'm excited and I'm looking forward to your channel that's going to come up soon, where you talk to different
Oh yeah,
doctors. And that should be something
yeah.
interesting. And I think that's the need of the hour. We would love to hear the stories from the doctors. So, all the best for that. And
Thank you so much.
yeah, and thanks. Okay, bye bye.